All right, welcome back to another episode. I am here live with Dr. Jones. He is a naturopathic doctor that specializes in something called PRP, and we're going to get into exactly what that is. But he has a practice here in Tigard, right down the street from Rhodes Chiropractic, and it's pretty interesting. Dr. Jones used to be a massage therapist, so he's been around the health and wellness industry for quite a while. But now he specializes in PRP injections, and we're going to talk about that. But Dr. Jones, welcome to the podcast. How you doing?
I'm doing great. Thanks so much for having me. I appreciate it.
Yeah, absolutely. And we are talking a little bit before we went live about your journey of how you found yourself doing PRP injections and became a naturopathic doctor. But can you give us a quick summary of your medical experience and your background and what led you to working in Tigard doing this kind of work?
So I've always had kind of an interest in research and helping people. For 10 years, I was a massage therapist, and it let me help people in a way that was kind of limited, but my mind wasn't stimulated enough. And so I did a weird thing, and I decided to become an entomologist and study ants for a little while. But while doing that, I wanted to learn more about how I could help people with lower back pain. So I listened to a talk by a naturopath about stem cells and PRP, and just decided right then and there in 2012 that that's what I wanted to do. And so I still had some classes to take and things like that to do the prerequisites to become a naturopath. And then I started my journey in school in 2015, graduated in 2020, and have been practicing since 2020.
That's awesome. Now, remind me where you went to get your doctorate.
I went to NUNM, the National University of Natural Medicine. They changed the name while we were in.
Is that here in Portland?
It is here in Portland.
That's what I thought.
Yeah, very near to downtown.
Okay, right on. Yeah, Portland has many awesome programs for chiropractors, naturopaths. I mean, it's definitely acupuncture. Yeah, it's got everything. Well, yeah, thanks for coming on the show and sharing with our audience what it is that you do. And we are just talking before we went live here that actually my wife is in the middle of doing PRP injections. And sometimes there's things that massage, chiro, PT just isn't enough. And she has a hip labral tear. Interesting enough, she was pregnant with our fourth child when unfortunately she was hit by a car.
Oh, wow.
Yeah, it was not a good scene. But long story short, had a labral tear. And now she's had 2 rounds of PRP and is doing much better.
That's awesome.
Yeah, but for our audience that says PRP, what the heck are you guys talking about? Can you, in the most simple terms that you can, explain what is PRP therapy and how does it work?
I can do that. So it's really a product of your own body. So what happens is we take a little bit of your blood and spin it down so that we separate out the red blood cells from the plasma. And then we concentrate the plasma down and harvest the platelets from that. So it's platelet-rich plasma, it's PRP.
Okay.
And we take that injectate, or we put it in a syringe, and then we use an ultrasound to find the area of your body that has been injured, and we inject it in there. And what happens is platelets are not actually a cell in your body. They're little packets of protein. And when they open, they release healing factors and inflammatory factors and all these things to mobilize your body's resources to damage tissue. And we've all seen them work, because anytime you've cut your arm or your leg or you scraped your knee, you've bled. And that's released platelets. And you'll notice that you pretty quickly get a scab, which then eventually days or weeks later turns into scar tissue. Those are platelets on the outside of your body. Well, they do the same thing on the inside of your body. Sometimes we just need to put them into the right place.
Wow, that's pretty wild. So someone comes in and you're taking their own blood, and within your clinic, you're spinning it down, isolating the platelets, and then later on, you're injecting that into the area that needs to heal.
Yeah, it all happens in the same day, and we get a lot of really great results from it. But it is pretty amazing what your body can do.
Yeah, we talk a lot about that in our clinic. That the body is meant to heal itself, and that's the way our, bodies were designed. And so that's very cool that you're using your own body's healing properties, on itself.
It's like we make our own nanomachines in a way.
Yeah, no, that's quite amazing. Now, when someone says stem cell, is that the same thing as PRP or is that different?
They're 2 different things.
Okay.
So stem cell, or in this case, to be very specific, is autologous mesenchymal stem cells, derived from fat tissue is
Okay.
what I utilize. That's a separate procedure that we extract using a mini liposuction,
Oh, wow.
often in combination with PRP for those additional growth factors. The two together work very, very well.
Wow. Okay. I'm definitely want to ask you a little bit more on that here in a second. But before we get into that, can you talk about, because if someone's hearing this, what exact conditions or injuries, is PRP the most effective on? When would someone know, hey, yeah, I need to go see Dr. Jones?
So it really is applicable to a wide variety of injuries and conditions. Everything, I kind of talk about it in a range of things, from chronic use, like osteoarthritis, to acute sports injury, like a partial thickness rotator cuff tear.
Okay.
And so they're useful. PRP is useful in that variety of conditions. So it may look a little bit different for the acute sports injury. We're going to go in, we're going to do a single injection, and we're going to help you heal with some kind of therapy in addition, likely to be just one injection. But versus, a pretty bad chronic degenerative knee, we might need to do 2 or 3 injections, and that therapy may look a little bit different, but it's useful for both conditions.
Okay. So it can be acute, like my wife, with the torn labrum, or something more chronic.
Yeah, I mean, severity plays into it as well, right? So if we, for instance, had a full thickness rupture of, let's say, a muscular tendon like supraspinatus,
Yeah.
that's not PRP, right? That's a surgery.
Sure.
But anything short of that, we
Right.
certainly can give it a try.
Yeah, there's kind of that pocket people can kind of get left in where, a lot of injuries will heal with, massage, chiro, PT. And then, there's this other, hey, you just need absolute surgery. And there's kind of this between, which people can kind of get stuck in, I've found.
Right.
And you would say, yeah, I'm kind of right in between there.
Exactly. So if they're, I get a lot of patients who want to avoid surgery.
Right.
Those
It's a big
can
pull.
Right. And so we can give it a try. And the great thing about it is if you do PRP, you can still do any other therapy afterward, right?
Okay.
You've given it a try. So you can still go do the surgery. You can still get the corticosteroid shot, all these things.
Okay.
Whereas a lot of times when you get the surgery, get the corticosteroid shot, you're not going to want to do PRP after that, because in the case of the surgery, what are you injecting? The tissue's not there anymore. Yeah. Or with the steroids act as kind of like a fire extinguisher to what PRP is trying to do. So they just don't play together very well.
I see. That's a good analogy. So you would suggest if, someone, and well, I guess my question would be, if someone is exploring injections, what would be, is there any disadvantage of doing PRP? I know there's limitations with, corticosteroids. It can deteriorate the tissues over time. Is there anything like that with PRP?
No.
Okay.
No, the biggest risk with PRP is an infection inside of the joint that's been infected. And that's true of any injection that goes into a joint.
Okay.
And so we just have a sterile protocol that we use to minimize that, making it less than a 1% chance.
Right.
But that's what I advise all my patients is that's really the only risk. You don't run the risk of an adverse reaction like you do with a steroid. And it certainly is not degenerative to the tissue.
Right.
In fact, it's quite the opposite.
Yeah, where it's a little more on the healing side. I mean, I know a lot of patients have talked to me about it. And what do you think of PRP? It sounds a little bit more regenerative, and, especially when someone's seeking, chiropractic care, they're definitely more how natural can I get,
Yeah.
So, and I'm guessing you get a lot of referrals from chiros and, other practitioners.
I do,
like me.
yeah. Chiropractors, acupuncturists, physical therapists. I like to work with kind of everybody because I feel like the patient, the fuller the patient experience, the better the results they're going to get.
Right.
And we're all in this to help people.
Absolutely. Yeah. I mean, that integrative approach and us working together is going to, whatever's best for the patient gives them the best outcome.
Absolutely.
So can let's say partially torn rotator cuff, so can one PRP injection heal it up? Are there studies or showing like before and afters it actually can heal it up where it doesn't even look like it's torn anymore?
Yes. So there are studies that do that, and I can provide those to you.
That's great.
And so sometimes one injection works. You have to make sure you harvest enough platelets. That's one of the biggest things we learned in the 2010s is a dose dependence in PRP. Before that, we didn't really know. We were just taking platelets. We were injecting it. And we were doing 3 because people were getting results in a series of 3. But now we know if we're injecting 10 billion platelets into an acute sports injury, we can definitely stimulate some healing.
Wow.
It doesn't happen overnight. I always tell my patients, you're healing for 6 months to a year afterward.
Oh, wow.
That doesn't mean don't be active.
Sure.
But that means be smart about how you ramp up your activity.
Right.
Right. Because in about 6 months, yes, we could do an ultrasound and take a look at the tissue that was damaged and potentially not find it again.
Yeah.
In 2 or 3 months, it's probably going to look pretty similar to how it did in the beginning because of how long it takes to heal.
Wow. So it can take a full year to heal up.
We're really taking advantage of the remodel phase,
right,
of injury healing.
And people, like you said, can continue continue PT. It
Absolutely.
Complements it. They don't have to stop everything. And
no, we what I advise to whichever practitioner I'm working with is the first week afterward, your patient's going to be a little bit sore.
Yeah.
Potentially, not everybody is, but I always tell people that because if they have it, they need to know it's normal. And to be a little gentle with them that first week. And so in the case of chiropractors, I think maybe, aggressive manipulation in the neck may not be warranted, but some laser, some ultrasound, shockwave, things like that are really great.
Yeah. Yeah. I know my wife just had a couple rounds, and that first day she was definitely like, we have 4 kids. She's like, hey, hon, I don't think I can pick the kids up and we can't do our normal workouts, but it wasn't, a couple days and she was fine and kind of back to her normal activity and doing workouts in a few days. So,
yeah, I mean, I've done my shoulder and I've had my lower back injected with PRP and I had a flare up for about 3 or 4 days each time. I've had patients who I'm like, it's great and it's lucky to be you, and they did not have a reaction.
Oh, wow.
They just started healing right away.
That's awesome.
And I've had other folks who are like, hey, doc, it's been 5-6 days. And I'm like, I know it's going to go away.
Yeah.
Better.
So what, are let's say the top 5 conditions and what body parts you can do? Shoulders, knees, hips. I mean, it sounds like you can do the neck, the low back, ankles. What are kind of the most common injuries and body parts you're doing this on?
So it kind of depends on the week, if I'm being honest with you. So some weeks I'm doing all knees.
Okay.
I would say
meniscus tears too. Can you throw in the conditions? Osteoarthritis, meniscus tears.
Osteoarthritis, meniscal tears, that's probably the bulk of them. Sometimes we get folks with chondral lesions that are basically like tears in their cartilage that go all the way down to the bone. We usually talk about stem cells for those.
Okay.
In the knee, we do a lot of partial rotator cuff tears.
Yeah.
A lot of tendonitis of the biceps tendon, and then just into arthritic shoulders.
Okay.
But if I had to put body parts, I would say lower back, knee, neck, shoulder.
All right. So what are you working on in the lower back? Is it disc issues? Is it, torn ligaments, sprained ligaments?
I do a lot of accident injuries. So people after automobile accidents, and it's usually an acute whiplash type of injury.
Okay.
But oftentimes people have, facet arthropathy. So the facet joints of the spine are inflamed.
Right.
Sometimes there's a bulging disc. Sometimes there's a small annular tear. All of those are conditions we can treat with PRP.
Yeah.
And so what I do is I inject into the paraspinal muscles in between the facet joint and the disc because PRP is not very viscous.
Okay.
It can saturate those tissues really well.
That's great.
And then the same thing with the neck. It's just placed a little bit differently.
Got it. And for the spine, people can pop up, walk that day. So I think some people are like, I got to work the next day. Am I going to be out for a week? But even in those areas, they can function.
Usually they can function the next day. If they're worried about it or have a very physically demanding job, I'll do the procedure on a Friday. So by Monday, they've had some time.
Yeah.
But I can tell you on mine, I mean, I end up bending in weird positions a lot because of the types of injections I'm doing. I was able to go to work the next day after my injection into my lower back.
I mean, that's pretty fantastic. That's great. Now what we've kind of hit on it a little bit, but that process of, can you walk them through what that looks like? They come in, they do a blood draw, they come back, they get injected, and then they follow up. Just kind of give us some bullet point, what does that journey look like?
Sure. So that's actually pretty easy. So usually they walk in the door, we have an evaluation, physical exams, imaging if they have it. If not, either I do the ultrasound in-house, if it's a condition that can be ultrasounded. Or I send them off for an MRI. We get an accurate diagnosis, so we know what tissue we need to inject.
Right.
So then they come in for their appointment after getting their instructions, bathing with antibiotic soap the night before, sleeping in clean sheets the night before, and then they come in to see me. We do the blood draw. I take the blood. We process the blood in the centrifuge. While I'm doing that, I have them wait in the waiting area while I'm prepping the room and sterilizing everything, getting the tray ready. Once the blood's done, we get that into the syringe and ready to go. I usually hide the needles because some people don't know they have a fear of needles yet.
Yeah.
And if they do, they tell me, and we, want to mitigate that.
Yeah.
So once they're in the room, I give them instructions about what level of clothing they need, whether they need a gown, just depending on the body part and what they've worn that day. We get them into position. I'm talking them through this. I think it's called signposting is what I've been told. Through each step, like I'm going to place my hand here. I'm going to clean you with sterile gel, all these things. Then I, let them know we're about to go on with the anesthetic. I place the ultrasound over the area so we have the target tissue in sight. Then we place the needle into the area, slowly injecting the lidocaine the whole time. Usually most people tell me that's the worst part. It stings. And I can attest to that.
Yeah.
Then the PRP goes in and I walk them through. It feels like a little bit of pressure going into the joint because you're numb. And then after they leave, I give them some post instructions, like avoid, you want to avoid NSAIDs like ibuprofen or Aleve afterwards. You want to not use cold and you want to use only heat. And they have some restrictions for 4 to 6 weeks afterward. And we set some follow-up visits after that to track their progress.
For like a month follow-up or so?
I do about 6 weeks. I find that 6 weeks out, people are definitively having some improvement that we can talk about. And then 12 weeks out is when we see maximal pain relief, even though we know the tissue is not done healing.
Right. Okay. And some people do 2-3 rounds. That's not uncommon.
It's not uncommon. It's pretty rare in my practice that we do more than 2 because I harvest quite a few platelets. I try to get about, 10 to 15 billion platelets. And so, usually we have good success with 1, but those folks at that 12-week follow-up who have responded, who have gotten 60, 70, 80% better, but want that little bit more. Those are the folks we talk about a second or possibly third injection. Especially my sports and athletes. They like that.
Yeah, that's awesome. I kind of have a funny story. My wife got it in her neck from a whiplash injury from a doctor that used to do this. And I went in the room. She was face down and she started doing them down her neck. And I started to see like little blood beads come out. And I actually almost passed out.
Oh, wow.
But I'm from a small town that used to hunt, fish, and, harvest deer and this, but seeing your loved one, I almost passed out. But my wife was like, what's wrong? Like she did amazing through it. So anyway.
Seeing it is something different entirely. I can say that even when I do this with patients, it's one thing, but doing this, like say with my wife, is a totally different thing.
Right. I know. It's like when our kids were born, like I almost passed out when the kids were being born. I'm like, I need a nurse over here. My wife's totally fine, but it was kind of funny. Now we can laugh at it. It wasn't funny in the moment. Are there any misconceptions about PRP that you hear people say something like that's just not true?
I think the biggest thing I hear is that it's either new or that there's no evidence for it.
Okay.
And I beg to differ.
Okay. Tell us about that.
There is a body of evidence. This has been around since the 1970s.
Okay.
Athletes have been using this for quite some time to get back and recover to their sport, their professional sport, for quite some time.
Okay.
The fact that we've been using this and the fact that there are literally mountains of data that are statistically relevant showing that this is a valuable treatment for a lot of different orthopedic conditions. I think it's just a travesty that this is not covered by insurance.
Right. And why do you think that is, that it's not covered by insurance?
I don't know that I have any real reason other than that somewhere there's no money to be made by somebody.
Sure.
You can't patent a person's own body's materials.
Sure.
Is my suspicion.
Okay.
However, if we were to compare this to a corticosteroid, which is covered, we know that corticosteroid long-term use for chronic conditions can lead to a lot of problems and metabolic issues for people, osteoporosis, not to mention the deterioration of the soft tissue itself.
Sure.
PRP has none of that and works just as well, if not better than
they've compared in studies
many times.
Yeah.
And at 6 months and 12 months, PRP hands down, almost every single time has a better result than the corticosteroid.
That's amazing. I mean, I don't know. I'm not in this world as much as you, but I have felt like as the years have gone on, there's more and more conversation around it, and it's become more and more used and popular. And maybe it's just this Portland metro area is more wellness based. And I have felt just over the years it's got more and more popular. Probably because a lot of those factors. And but also I do know auto insurance does cover it, right?
That is
Like
correct,
that is
yeah.
one insurance carrier. Like for my wife, she's going through an accident and it's getting covered. So there are, select few that do cover it.
So definitely PIP coverage
Uh-huh.
and your automobile insurance covers it. There's a few exceptions to that, but we can always it's a process.
Yeah.
And then if you're active duty military member with TRICARE, it also covers PRP. But those are the only two types of insurance that I'm aware of that does cover.
Yeah, we take TRICARE here. I didn't know that. That's pretty awesome. But then of course, people mostly pay out of pocket. Now, some people you start talking stem cells. I've had patients walk in with, quotes on like, hey, I'm going to do a series of 2 or 3 stem cells, which is different. I want to get to that into a disc and it's $10,000. What is it for, let's say, a torn rotator cuff if someone came in for one session? Just kind of rough idea.
If we were talking about PRP, it'd be $750.
Oh,
is what we do for an injection.
Yeah.
And then if we take your insurance, we bill your insurance for all the follow-up visits from that. And then if we don't, we always throw in the first follow-up as just something we want to make sure you're on the right track. That
Sure.
that we've done well and that, we don't need to do something else.
Right.
And then after that, we have a very affordable pay at time of service rate.
Okay. Yeah, that's fantastic. Thanks for sharing that. Because I know when you start talking PRP stem cells and injections, I've had quotes from other local clinics where it's $8,000-$10,000. So $750 seems a lot more doable, especially if you want to avoid surgery and it's that effective. I think that's money well spent on your health.
I think of it as an investment for your body.
Yeah.
You invest in your car, you do regular maintenance.
Right.
I'll be honest with you. I wanted to name my clinic Tin Man because I thought of the Wizard of Oz and
there you
everybody
go.
puts a little oil in their joints.
Yeah, we sure do. So let's get into, and I'm also a little confused, the difference between PRP and stem cell. And when do you use one over the other? You mentioned there's times where you use them in combination. Can you walk us through that?
Sure. I almost always prefer to use them in combination.
Okay.
And I will tell you that the biggest obstacle is unfortunately cost.
Okay.
They're expensive procedures to do. So, for instance, in my practice, an adipose-derived stem cell and PRP injection costs around $3,000.
I see.
And as a rough estimate.
Yeah.
So that's one thing. The other thing is I think of stem cells for more severe conditions.
Okay.
There is a very small chance that a person may not respond to their own PRP or stem cell.
Okay.
So I like to use PRP to kind of see, are you a responder or are you a non-responder? And if you are, then I like to talk about the stem cells.
I see.
Because then we know you're going to respond to
And
your
that
stem
might
cell.
take them to the next level.
Exactly.
Okay.
But if we're talking, I've had, for instance, a patient, he was a 60-year-old postal carrier who had bone-on-bone knees and wanted to avoid getting replacements until he was 65 when he didn't have a copay for Medicare.
Okay.
So I said, sure, if we're going to do that, we should try stem cells. PRP is not going to do it for you.
Okay.
That was, his knees were too far gone. So we did the combination therapy with him. We did an injection on him and we got him really relatively pain-free.
Wow.
Actually really love his story because I told him to take it easy, right? The guy was a basketball player, long distance cyclist and that kind of thing.
Okay.
So I said, hey man, I want you to get on your bike. Yes. But don't go crazy like you did when you were in your 30s.
Okay.
Start slow. So he emails me and says, hey doc, my knees are swollen. Do you have some advice for me? And I said, sure. And I gave him some advice, but what happened, if you don't mind my asking? And he said, well, I rode my bike. I went 60 miles and my knees swelled up. And I was like, I thought we talked about taking this easy. And he said, well, I was feeling so good and 120 miles is what I used to do. So 60 was taking it easy. And he lasted 18 months before he needed a booster shot of PRP.
Okay. Wow. I mean, that's fantastic. Those are great results. And I know a lot of people are wanting to delay the, knee replacements and That's pretty amazing. All right, let's see. What other questions do I have for you? Um, that was actually one of my questions here is, yeah, what other success stories do you have? I mean, that's an amazing one. Other shoulder ones, hip ones. I mean,
I have a great
can
head.
you think of a few?
I have a few. I have a few. I'll edit myself down a little bit, but
Okay.
the one I love in the hip is actually PRP.
Okay.
This gentleman needed new hips, and just couldn't do stem cells. He was also just basically too frail for hip replacements at 93 years
Oh,
old.
wow. 93.
93,
Okay.
getting on a walker.
Wow.
And so he's in a walker.
Okay.
We inject him with PRP into his hip joint and then into the extra articular spaces around the greater trochanter,
Okay.
because he was having just such severe hip pain. And I think of this as a quote unquote shotgun approach here
Yeah.
with PRP. We want to hit everything if we can.
Sure.
So we did that for him in a series of 3. At his last follow-up, after his 3rd injection of PRP, he had no assistance at all for walking. So he was walking completely, no walker, no cane at 93 years old after he had been on a walker for quite some time.
Wow.
And his quality of life, he was so incredibly happy that he could just walk and he didn't have to use the scooter.
Wow.
In the grocery store. It was amazing for him. And
That is
we were all very
incredible.
happy.
Wow. So there really isn't an age limit on who can do this. I mean,
No.
Teenagers,
Yes.
you know,
I've done student athletes.
okay.
So we've done now Osgood Slaughter. I should just address that specifically because that may come up with child athletes.
Yeah.
PRP is not for that.
Okay.
But I've had some torn ligaments. I've had some basically a non-complex torn meniscus in a high jumper that we injected that was able to get it back to sport in the outdoor season.
That's cool.
Things like that. I've also had partial thickness rotator cuff tears in my tennis and pickleball players. Because we know our pickleball players want to get out and start playing, and so they're all about it. But I had a great story about a guy getting back to his league play.
That's awesome.
After an injection.
That's fantastic. Yeah, those are great, fantastic results. Can I ask you a couple of follow-up questions? I know we're almost out of time here. But does someone need a referral to come see you? Let's say someone's listening. Do they have to have their PCP or a chiro or someone refer, or can they just call you and look up active pain relief, Dr. Christopher Jones, and just call you and come in?
Absolutely. Yeah. Anybody's welcome to come in. I do free 15-minute consultations. And in that time, we can kind of suss out if, what you have going on is a good fit for what I do. And I have a great referral network of people to help people kind of navigate the medical system to get them where they need for pain relief.
That's awesome. That's fantastic. And I think that's, one other maybe misconception is, they need to go jump through these hoops, because that is kind of the main medical model is, hey, you need to do 6 weeks of physical therapy and then do this and then do this to get referred to this doctor. So it's a little bit different in this situation.
Yeah, I agree. And I will say because you're a chiropractor, like like an acute injury right after, you guys start treating with adjustments and everything that you do in your office. Usually if you have someone who's like, let's say 4 to 6 weeks into treatment with you, and maybe they've gotten better, but they've plateaued or they haven't really improved, that's kind of when I look at a referral from a provider.
Right.
But as far as a patient watching, on the street, right now, if you have questions, I'm always available to answer and talk with folks.
Yeah, that's awesome. Yeah. Thank you for addressing these kind of common questions. And I'm learning a lot as well. Just to kind of wrap up here, can you, anything else you wanted to add, feel free. And then for, our local listeners, where's your facility? I've mentioned your clinic name, but any other places they can find you and look you up?
Oh, sure. So we're on Facebook and Instagram. And then also I am at 9975 Southwest Fruing Street in Tigard, right next to Taqueria Sanchez. That seems to be a pretty popular Mexican food place. And then I do a lot of local events. I'm going to be at the summer concert events with Tigard. And then I do a lot of health fairs here in Tigard as well. So you can find me there. And then you can also find me oftentimes at lunch at Taqueria Sanchez.
That's awesome. So you're really, it's only like maybe a mile down the street from us.
Right. Yeah, we're very close, to each other. I would say not even a mile.
Yeah. And you mentioned in an earlier conversation that you used to work in a chiropractic facility. So, I mean, you really understand chiros and what goes into that. And so
Yes.
for, chiros that maybe are listening and wanting to refer, you really understand how like a chiropractic clinic works and what's going through their mind and work very good hand in hand with them.
Absolutely. I love working with chiropractors. I feel like it's the type of therapy that I'm doing, the type of injection therapy I do, and chiropractic care work very synergistically together. And so I really appreciate being able to collaborate with other providers like that.
Yeah. Yeah, well, Dr. Jones, thanks for coming on the podcast and taking the time out of your day to, record this. And, this is definitely a podcast. I want to be able to send patients that are asking questions about it. And so, yeah, I really appreciate you coming on, sharing your knowledge and helping our listeners.
Thank you so much for having me. I appreciate you having me in here
Yeah,
today.
absolutely. This was a lot of fun. Thank you.